1. Good morning on behalf of Epilepsy.com and our podcasts, and to our readers and listeners of Epilepsy.com. We're very excited this morning as we have a special interview with two special guests that are going to be talking about epilepsy and experiences with epilepsy and how to take control of it. Joining me today to help me with the interview is the CEO and founder of the Epilepsy Therapy Project, of which Epilepsy.com is a part, and that is Mr. Warren Lammert, and I am Dr. Joseph Sirven, one of the editors of the Epilepsy.com professional site. So this morning our guests are Greg Grunberg, star of the hit television series Heroes and father of a 14-year-old son with epilepsy, and Dr. Brien Smith, who is medical director of the epilepsy program at the Henry Ford Hospital in Detroit, Michigan. So, gentlemen, good morning, and thanks again for joining us.
Good morning. Good morning.
I guess let me start off with the question, and I'm going to kind of tee it up for Greg. First of all, I know for our listeners who may or may not know, I know that you are a father of a 14-year-old with epilepsy. So I guess the first question we have is, how is your son Jake doing now?
Jake's doing pretty well. We have three boys. Jake's our oldest, and he's just about to turn 14. And for people that don't know, or to tell my story, Jake, right before he turned 7, he started having staring spells, or he would daydream. And we knew really very, very little about epilepsy, which most people, I think, have had the same experience. They in grade school, or they've seen someone drop to the ground and shake around and have a big seizure. That was pretty much our exposure to it. And Jake, we would reprimand him because we knew nothing about it. So we'd say, Jake, stop staring, stop ignoring us. And had a 7-year checkup, which really his pediatrician did the right thing. He said, look, I'm not a specialist in this. I don't know exactly, but I think that he's having seizures, and I think you need to see a neurologist. He then pointed us in the direction of a neurologist who didn't specialize in epilepsy. So it took us about, a good 9-10 months to get to an epileptologist and find the right treatment for Jake. And now, he's going through puberty, which doesn't help the situation at all. But we really do have kind of the right combinations. Jake's had really kind of run the gamut. He has a vagal nerve stimulator. He's had surgery, but right now he's on the right combination of meds and care, and he's doing really, really well.
We're delighted to hear that. Warren, I guess do you have a question that you'd like to get in there before I kind of go from here?
I guess I'd like to ask from your standpoint, and I first of all want to say thank you for speaking out as the father of a 13-year-old girl who has unfortunately lived with epilepsy since she was 1 and is still uncontrolled, though we have a VNS and are on 3 different meds. Mm-hmm. I think it's so important for people to speak out, and so it's just terrific to have you on the site talking to our users. And Greg, how do you recommend other parents approach epilepsy, and how do they effectively take control of their epilepsy in the way that you and your family have been able to?
I think if we were doing it all over again, if Jake was diagnosed today and we knew what we know now, I would tell people to go to epilepsy.com, go to epilepsyadvocate.com, go to the websites that have information, not just stories that are going to frighten you, because that's a lot of times if you just do a search online and you don't have the right place to go, and talk to like-minded people. I mean, to hear you say what you just said, it's very comforting to know that there's someone. Every time I hear it, and I know there's 3 million people that deal with this and parents that deal with this, but it's very lonely when Jake's having a seizure and there's nothing else we can really do but hold him and make sure he's okay until it rides itself out. And but to hear that people are going through what we're going through and to glean a little bit of information. I mean, one of the advocates that I talked to, Jake he plays baseball, he goes to school, he's like a normal kid unless you see him have a seizure. And one of the things that we heard from another parent was maybe it might work for you, Jake, if he's running around the bases, he's breathing heavy, and after he just did something strenuous exercise-wise, have him kind of step down gradually. Don't just sit down, because that from 0 to 60 or 60 back to 0, that might cause. And sure enough, he just makes sure he walks things off or just gradually, and it's helped. And that's just a tiny bit of information, but the more empowered you are, the more information you have, the better you feel as a parent, obviously. And the other thing that I would say is don't stop, don't settle, and keep going. If you have to seek out a second opinion, doctors in this area want nothing more than seizure freedom for you or your child, and they work together. And so and it's all a matter of experience, and the more experience a doctor has, the better they are to help you and figure out what's the best combination of treatment for you. So there's nothing wrong with saying, let's see someone and get a second opinion if you have to. We've had to do that, and we're very lucky that we have great care for Jake. But it's out there, and websites like like Epilepsy.com and EpilepsyAdvocate.com are a great place to start.
Thanks. There's a question for Dr. Smith. As you listen to Warren about he's a father with a child with epilepsy, you listen to Greg and his experiences, how best do you advise physicians and nurses, people who are on the healthcare side of this, how we can best help our patients, particularly since our audience is a professional one, at least for a big portion of it? How would you advise that as you listen to these comments?
Well, obviously, there are a third of the patients out there who are medically refractory. They're not responding like they should be to the medication, and these are challenges. And we need to be sure that we have an open ear to all their concerns. We're hearing what's happening with the seizures, how frequent they are, what's happening with the medications. The assumption that this side effect is tolerable is not an assumption we should be making. We need to have that interaction directly with the patients and with the parents. EpilepsyAdvocate.com puts a lot of these questions out there, like Epilepsy.com, to try to educate, empower patients so they can be part of that healthcare team and working and making decisions. I mean, if you have a child, or if it's just you and your seizures aren't controlled, you want to be aware of everything that's happening out there. What is there a research trial that I could be part of? What else is happening? Warren, your group is doing a great job in trying to open doors and looking outside the box for options for some of these patients, because we can't just sit there and say, okay, this is okay for me. I can have 4 seizures a week, and I won't be able to go in this direction in my life. We know how research studies are, and we know that we want to get things done quickly, but we need to move things further ahead as quick as possible. We need to get funding, and it's just important that we share our stories, and our patients and our parents, they feel comfortable that their questions have been answered, they've been listened to when they see their doctor.
I appreciate that, and it's great advice to our listeners. Warren, any final question for these two?
Well, when do you decide to seek further help? Many people with epilepsy are treated by general practitioners. Many are treated by general neurologists and don't keep going up the chain. When do they do that, and how do they make that move?
I can just talk from our personal experience. Everybody has to make that decision for themselves, I think. And for us, we just wanted these seizures to stop. I mean, we wanted Jake to, obviously not have any seizures. So we waited too long, I have to admit, when we were just with a general neurologist. It wasn't our fault. We just didn't know. It's honestly, it's just this information that's out there. You can really. I started a website called talkaboutit.org. Talkaboutit.org is exactly that. It's talking about this, and people interchanging information, and that might be a place if you see someone who's as close to your situation as possible. Obviously, this is not a one-size-fits-all condition, so you're not going to find somebody who's exactly in your situation. So I think it really varies from person to person. But for us, we moved very quickly, and at times I feel like we didn't move quick enough, but we didn't know what our options were. And I just think it's a race to get to seizure freedom any way you can. We've done everything, and we will continue to do everything as new research comes out and new treatments come out until Jake is 100% seizure free. I mean, that's what the ultimate goal is. So I think it's a choice, individual choice with everybody, but don't wait too long to move to the next step and see somebody who might have more experience than the person you're seeing now.
And I would just briefly add that the bottom line is once someone has failed 2 appropriate medications, that's a red flag that this is going to be a difficult case, and there's a good chance that other seizure medicines may not make them seizure-free. And I think that's really a point where you clearly have to look to going to a comprehensive epilepsy center for an evaluation.
Great advice, and again, I want to thank you both so very much for helping our audience, our listeners, our readers of our site to really talk about epilepsy, to really help share experiences. Again, thank you, Mr. Grunberg, and thank you, Dr. Smith, for joining us, and we really appreciate all that you're doing on behalf of the epilepsy community and how we can help stop this.
Yeah, and Joe, I'd just like to add my thanks as a parent to both Greg and Brien. It is so important to speak up. So many people don't speak up about epilepsy. I think it's one reason we haven't been more successful in solving this problem, with a third of people still uncontrolled and, many living with tough side effects from the therapies that they're on. So
I'd like to add, I know it's going to sound like a love fest, but I want to thank you guys because we're doing a lot of interviews this morning. We have a lot more to do, but talking to the two of you was something that I was really looking forward to doing, and I can't thank you enough for what you do as a parent. It's so important, and I am here for you guys. Whatever you need, if you need me to do anything else on the site, please don't hesitate, and I really mean that. That's why I'm here. That's what I'm trying to do, and use my celebrity, quote-unquote celebrity, to get the word out about this. It's just too important.
Wonderful.
Thank you so much for that, and again, thanks for this morning.
Phone and video at least,
the
and I look
feeling
forward
is
to meeting in person.
absolutely mutual, and any way we can help any of your sites as well.
Thank you.
Thank you very much.